Welcome back to Balanced Health. There's more to alternative therapies than acupuncture and aromatherapy. Many of you sent in some questions about some alternative treatments, and Dr. Terry Smith, a holistic physician, is here to set the record straight on some of these confusing issues, and we're glad to have you. Welcome back. Thank you for staying with us through our cooking and shopping.
That was awesome. I wanted the apple pie. I didn't want to leave the set, actually.
We'll give you a bite later.
I know you also want to comment on the aluminum thing, and we're going to do that in just a second. We want to take one question from a caller, and then after we answer the question, I'd like you to go back to that aluminum thing.
Yes.
This call is from Levon from Chicago. Levon, welcome to the program. How can we help you today?
Yes, I want to know, is the airborne really effective if they...
Okay.
Is the airborne really effective?
Effective, and I think she's talking, I've seen it on TV advertised, this is what you're supposed to take before you get on a plane or something to keep you from getting sick?
Yeah, well, there's several products. Airborne's one of them. Surely, I have never personally used it, but with the, you know, Kylia serves over 100,000 people, and the feedback we have gotten from them is that it is very effective.
Okay.
They take it when they fly, they swear by it. Here's the main thing we want to do. One of the first things in medicine, the oath is to what? Do no harm.
Right.
And I see no harm in taking that product, and I see only an upside. So
good. So try it.
Absolutely.
That's good.
Yeah, we have a few patients that have taken it too, and they all love it. So
really?
I haven't examined it too much yet, but everyone seems to love it who have taken it. So.
Well, that's great. And your patients are pretty savvy about what works.
Yeah,
when
the patients finally come to me, they've already been to many other physicians who have either, you know, maybe I wouldn't want to say failed, but they didn't just get what they were looking for. So when they come to me, we have a pretty wide scope of things that we're going to try and do.
Good.
Well, Dr. Smith, you I know are kind of passionate about metal toxicity, and I could see your interest when we were talking about aluminum. Talk about the metal toxicity that you see in your patients and how much that plays a role in their overall health as well as their joint health.
Well, aluminum is #1. Mercury would be my #2. In Chicagoland area, mercury is 10% higher than anywhere else in the country.
You're kidding.
It is the leading cause of thyroid problems. And when you have a little bit sluggish thyroid, cholesterol levels go up. So we're already talking about a tiered system on diseases just from one little thing. The aluminum, you know, not only present in deodorants, it is the, what do you call it, binding agent in flowers, white refined flowers.
Oh, you're kidding.
The reason why it doesn't clump together is aluminum.
Oh my goodness!
Yeah.
So even the unbleached flour has that in it?
Yeah, it has some kind of, you know, degree of aluminum type stuff, and ADD for children, that's one of the biggest ones that we've seen. Any child that comes in with ADD has either aluminum, cadmium, or mercury as a toxicity agent.
Unbelievable.
And we talked about aluminum, where it comes from. Mercury comes from fish, especially the bigger the fish, the more, right?
The bigger, more mature fish have more mercury.
Yeah. Vaccinations?
Vaccinations is a big one. Autism and all that other kind of stuff related into that subject. We won't get too much into it. But I had one of the sharpest executives come into my office just a few months ago, and he was eating a can of tuna every day. It was the only thing he changed in his diet. He added this can of tuna because he thought omega-3s were good.
Yeah.
And about 3-4 months into the process, he started losing his sharpness. His mind was starting to lose his memory. I said, let's just do a mercury sample, you know, test to see if you got it in you, and he came in off the charts. But it only took about a month and a half to get it out of the system for him.
Wait. Tuna is supposed to be fairly healthy. I know it's a bigger fish, but I thought we had talked on that it's pretty safe. So was it the kind of tuna he was using, you think?
Well, this is the thing. It was in a can. It was canned tuna. We don't know how big that fish was, how much mercury it absorbed or whatever, but also the aluminum or whatever else metals may have been soaked in to the tuna. So we had a high aluminum and a high mercury, but when we detoxed the mercury, about a month and a half later, the guy was sharp as a tack again.
Wow.
Well, and he was also eating it every day.
Every single day.
We go back to the moderation thing, and the thing about tuna, Shirley, is first of all, he was misled. It's not a high source of omega-3s because it's a very lean fish. Okay, you want omega-3s are found in fatty fish like salmon. You know, but you go back to that thing of every day, eating it every day. We talked earlier in the show about eggs. You know, I still, as much as I love eggs and recommend them, I wouldn't recommend people eat 3-4 eggs every day of the week, every day of the week. I mean, you know, your body needs that to cycle stuff in and out.
Moderation. Well, let me go.
Some viewer questions.
Let me go to another viewer question here. When is it absolutely necessary for surgery as it relates to the spine or vertebrae? I know you hear so many horror stories about back surgery. Are there times, and when is that time when you have to have surgery?
Because we deal with this so primarily in our office as chiropractic physicians, that these, you know, people oftentimes come to us at the end of the road. I've tried all this, I've tried all this. But between actually chiropractic and surgery, there's some other bunch of steps that people never have tried. Pain management in some other ways. We might talk about that a little bit, but chiropractic specifically, if you saw 100 chiropractors, you might get 100 different styles of chiropractic treatment.
Wow. Really?
So if you have failed maybe at 3 or 4 different style of chiropractic, you don't have to give up just yet. The real answer is, when is it absolutely necessary? When the patient can no longer handle daily living at that state is really the best time.
And are the surgeries really helpful and effective much of the time?
20 years ago, I would have absolutely not put my worst enemy through back surgery.
Right.
Now there are some different techniques that are very safe and effective, but they're not meant to be used as the first trial or even second trial or third trial back pain. There's some things that you need to do.
All right.
Yeah, traction.
So as a last resort.
As a very last resort. And there's about four different styles of surgery now, and there's one specifically called a Metrex lumbar discectomy that doesn't use knives to cut all the muscles. It's like a scoping procedure for the elbow or knee, how fast people recover from that now.
Yeah.
There is a procedure for the back like that too.
Well, that's encouraging, that there's better methods.
Yeah.
Our next viewer question, Dr. Smith, and I'm kind of smirking a little bit because I deal with this myself and you've yanked on mine enough. It says, is it really true? I've heard that most people have one leg longer than the other. Now, I'm guessing the answer is going to be yes because we wouldn't ask it otherwise, but when you're walking around, you say, is the answer yes, and if so, how does that happen?
Well, the only way to know is to close your eyes and then walk and see if you walk in a circle and know.
And for sure
I know
you got
it's
issues.
true because one leg of my pants are always shorter than the other, and I'm thinking, if this is true, why don't they just make them? Why don't they make the
You just
pants
made
like
yourself
that?
an appointment, lady, because I'll tell you right there, there's got to be some
short
issues
legs,
from
a
that.
functional short leg, which is, acquired through either physical activity. A lot of athletes acquire a short leg because they drive so much power through one side of their body versus the other, a dominant side.
That would be the reason mine is. No.
Probably. And then there's the anatomic short leg where you're actually born with, or you grow a little bit short leg on that side, but that's only about 5 to 8% of the population. So if you're walking around with a short leg, you should at least try to get it fixed, and specific chiropractic manipulations of the pelvis can oftentimes get that back to balance. And the symptoms of having a short leg could be ankle pain, could be knee pain, hip pain, back pain, neck pain. Virtually any type of pain in the body can be caused by an offset. Imagine driving around with 2 flat tires on your car, and the alignment's not going to be.
So it causes a lot of other problems.
Could be the root cause of many other problems in the body.
Well, here's we only have a few seconds, but here's one more question. In exercise, what's more important, anaerobic or aerobic?
I would say for 99% of the population, just get out moving around for 45 minutes to an hour. So it would be in the aerobic, type of exercise where you can basically talk freely while you're doing it. And get your heart rate, going a little bit, but do a little bit every day. It has to be every day.
Really?
Yeah. You got to get going every day.
Doesn't have to be a workout every day. You need some movement every day.
You can't lay on the sofa,
Anaerobic exercise, I don't know if people are familiar with the term, but that's basically very, very intense exercise for short durations of time because you simply can't hold that threshold for very long. But I'd rather people do a ton of aerobic exercise and get that heart comfortable.
Good, thank you. Well, the important thing is keep moving.